welcome to the continuing series of South Florida Hospital News leadership videos. These interviews are conversations with the leadership of South Florida hospitals and other healthcare providers in the local area. Today, we welcome Matt Love. Matt is with Nicklaus Children's Health System. You might know that by another name that was changed a few years back, but we'll go into that. So Matt, I want to thank you for taking the time out today out of your busy day to spend a few minutes with us and talk about yourself and Nicklaus Children's Hospital System.
Thank you. I'm glad to be here.
Matt, can you tell us your position with Nicklaus Children's?
Yeah, so it's my honor and privilege to be the president and CEO of the health system, Nicklaus Children's Health System.
But tell us a little bit about your family, where you came from, your family today, that type of thing.
I came from the Midwest, Ohio.
Mm-hmm.
Spent most of my life in up on the lake, Northeast Ohio. This time of year, I love it down here compared to up there because it's chilly and cold, right? Been here about 3 years. I have a wonderful wife. We've been married almost 30 years. A son, a daughter, both grown, and a granddaughter as well.
So tell us a little bit about your education background, the schools you went to, and that type of thing.
So I went to the Ohio State University for my undergrad.
Mm-hmm.
Interestingly, I am actually an industrial engineer by education. And so a very different pathway, very different educational component. And then I have a master's in business administration from Cleveland State University. And so I spent most of my time, in the finance and the operations world, for the first, 25 or 26 years of my career.
Mm-hmm.
And then when I came down here, became CEO. So kind of a non-traditional pathway, right?
Mm-hmm.
A finance guy that didn't have a finance degree.
During your career and coming up to healthcare and dealing in healthcare, what were some of the major challenges you found through the journey?
Folks understanding, how we access care, how care is delivered. Most of the time as a parent or a patient, right, you see it from the patient care side of things. How do I make an appointment? How do I get a procedure done? And then deal with, of course, the headaches on the bills and the billing side of things. I think, being from the inside, you see it differently, right? It's about, all the people that work at organizations. People working really hard, trying really hard for all the right reasons. And what I've loved and seen over the challenges is how do you mirror the business side of healthcare with the patient care side of healthcare, right? Bringing those two worlds together is really where the magic happens. And so I've been fortunate enough to be able to see a lot of that in different organizations to be able to bring those two pieces together.
As you've come through your career, what were some of the mentors during that period of time, and how today do you see yourself as a mentor to others?
So there's two people that really stand out in my mind. One's on the finance side, a guy by the name of Kevin Roberts. He really taught me the importance of understanding, what we do on the finance side, on the business side, and how it connects back to patients. The other one is a lady by the name of Mary Armour, who was a nurse. And I actually worked for her at the Children's Hospital in Memphis. And she's the one that really helped me understand, patients and families first. It's really all about taking care of kids. And so those two, if I kind of put them together, you get Matt Love in terms of the mentoring piece.
What does your typical day or day look like? And, as Matt Love is working with the hospital, but also making rounds in the hospital.
So my day always starts early. I always like to be the first one in. 4 out of 5 days I usually am, but it's early because I like to come in and get things done. But then getting out, walking through the hospital, talking to the staff, seeing the patients, seeing the families, with the high, with the increased volumes and everything that's been going on the last couple of months, I spend a lot of time in the ED. It's a busy place right now. But there's not, like you said, there's nothing more rewarding than seeing kids getting taken care of.
So with the hospital going back over the last couple of years with COVID kind of taking over our life in general, especially in the healthcare space, what have you seen that actually kind of maybe made things better relating to services or staff that maybe you didn't expect? But there was, what's the good part of COVID that came out of this? Basically running a hospital, dealing with staff, and dealing with certain situations.
What we do hasn't changed, right? Taking care of kids, being patients and families first, all of that has gone through COVID and should always, extend past, people that are sitting in this chair, right? So that's who we are. But, when I reflect on kind of what we've seen over the last couple of years in terms of the resilience of folks is just amazing, right? People are coming to work. I mean, the frontline folks in the ED, if I recall early on in the pandemic, folks were scared, right? We didn't know what we didn't know back in 2 years ago. But, our doctors in the ED, our nurses in the ED, everyone really stepped up. And so you saw the best in folks coming out, in terms of almost the worst of times, if I can characterize it that way. And then what we saw come out of it, right? Telemedicine, right? It accelerated telemedicine almost overnight. I think that's here to stay to some degree, right? People don't want to travel. It's, tough to get in your car and drive, 30 minutes up the road for kind of a routine type of visit. So I think, that's a good thing that came out of it.
There are a lot of people that are going to be watching this that are the up and comings, the people either undergraduate thinking about healthcare, people in graduate that are going for their masters, and those that are in entry levels or mid-level jobs within hospitals, other healthcare organization. What advice, one piece of advice, would you give to those individuals that would help their career kind of accelerate and keep them on a straight line towards the mission?
A big part of it, two things, and then I want to talk about a couple of specific things. You got to love what you do, right? You got to come to work every day, and you got to love it. You got to be passionate about it. But more on a fundamental level, folks, I tell folks, you got to stay curious, you got to be patient, and you got to have balance, right? So what do I mean by that? Being curious is the best place to be, right? When someone comes to you and brings a problem or brings a solution or brings a conversation, being curious as to what the issues are, what were the possible solutions, where were people at in the mental frame of mind, what was the background, their filters that they come in. Be curious, because with curiosity you can get to the solution. Be patient. Don't be afraid to make mistakes. And things happen at a pace. You have to accelerate it and be aggressive in certain situations, but you're not going to be CEO overnight. Nor do you want to be, right? Because there's so much that you wouldn't know. And then balance. As I said earlier, I'm a family man. I love my family. I love to work. I work a ton of hours. Don't get me wrong. But I also know that, why I'm on the earth and what my purpose here is also to be a father, a grandfather, and a husband. So in my mind, you got to be able to do both. And it's never 50-50, right? On any given, it doesn't happen.
Never.
It's 70-30, 60-40, 80-10, 80-20, whatever it is. But there's got to have you got to have a balance, I think, between the different components of your life.
What kind of keeps you up or keeps you thinking, trying to get to sleep, those things that kind of keep you up at night? What relating to healthcare, especially the last 2 years, but in general, what kind of keeps you up at night relating to the healthcare and running the hospital?
Yeah, I worry about two big things related to primarily around pediatric healthcare. One is access. Access to healthcare is always tough. I mean, in getting appointments, getting in quickly, and there's lots of barriers to get in, whether they be transportation or economics or financial, whatever it may be. But access to healthcare for everybody. The second one is really around, we started the conversation earlier around, the economics of it, right? The funding. We're 70% Medicaid. And so, we are heavily dependent on the government and Medicaid in terms of funding for our services here. And that worries me. And, no other industry, no other, very few hospitals in the state of Florida are as much Medicaid as we are. And so, the stroke of a pen's changes in, from a political perspective could have huge impacts to us.
Mm. Well, Matt, I know you have a very busy day. And again, I want to take the time to thank you for being with us today and your support of South Florida Hospital News and Healthcare Report. And we will see you hopefully as things ease up a little bit. If you allow me in, I'd love to come down and see Nicklaus Children's. I haven't been there in a while. So we'll see you next time.